Yeah.
these GI tests where you test for parasites, but then you're talking about ones in the brain or the blood, you know.
Yeah.
How does that work? How do they get where they are?
Well, I don't know the exact mechanism. I mean, certainly through the bloodstream, and like the Lyme spirochete, what does it do? It can pretty much burrow its way anywhere. So if, you know, there's so much we don't know. There's so much we don't know. But if there's something in the brain, is it the actual parasite itself causing the problem? Is it the inflammation because it's in your brain that's causing the problem?
So you could have a GI test, one of these analyses, and they say, oh no, you don't have parasites. Well, it could mean that you don't have parasites there, but it doesn't mean you couldn't have them in your brain.
Right, right. And or it might be a test, they're not looking for that particular parasite they have in the GI tract. You know. Tapeworms are really tough to find. You know. But
so do you just sort of assume and just treat, or do you test first?
well, I try to test, but many of my patients don't have a lot of money, and those are all tests. Usually they've been tested for the typical traditional ova and parasites through the clinic labs, and the tests are negative. So if, you know, doctor's data, Genova diagnostics, they're great. They cost. And we all know that how the financial problems play into chronic disease. It's difficult. So what I found was Dr. Klinghart's parasite protocol a number of years ago. And I have been using that on my patients who present with symptoms that don't seem to be alleviated by the other treatments that I've been doing. Among them, the GI bloating, itching, psychiatric issues, insomnia. And usually what I've been doing is trialing them on ivermectin first. Pinex, the old pinworm medication that's over the counter, that along with ivermectin. And if there's any kind of response, you know, it's like using any kind of medication. If you go out and buy Claritin, well, no, I shouldn't say that, but you know, they may or may not work depending on what you have. But his protocol uses a number of different antiparasitic medications. So we're covering a number of different parasites in the different places they can be hiding. And the herxine that I see ranges from none to GI, to stool changes, to psychiatric, to behavior changes, to insomnia, to hypersomnolence, to all kinds of things. So if it's a neuro symptom, it sure makes me think they're herxine. And then and that's of course, you know, so much of this is trial and error at this point, until we have more appropriately specific diagnostic testing. That's what we're doing.
Regarding parasites, I tried, I learned from actually someone in Florida that taught me this. There's a doctor out in California named Dr. Nathan, or Dr. Nathan Neal, I'm not sure. Nathan. But anyway, he tested several people with multiple chemical sensitivities, and he did a sinus wash and put it right under the microscope, I think. And it was like more than 90% of those people who had multiple chemical sensitivities had these parasites in their sinus wash. And so he understood that. That's why, as long as you know, there's a certain chemical neurotoxin excreted by these parasites in your sinuses, so another chemical comes in and, you know, you have these horrible reactions,
Sure.
which I had for years. And he recommended ivermectin. And of course, you know, I couldn't get it. Anyway, I was able to get a trial from one of my doctors. She gave me a prescription. I got ivermectin from community pharmacy, and that has worked wonders for me. but now community pharmacy doesn't wanna do it anymore, and I don't know why. So I had to go through Walmart Pharmacy, and they got it for me. And I noticed my doctor wanted me to take 5 milligrams three times a week. And that really helped, but then I went up to 10, and then I went up to 15, around the full moon too. And that really, really helped, you know.
The first person I ever used ivermectin on was I'd heard about a link years ago with MS and parasites. And I had this very interesting family of 4 women, 3 of them had MS diagnoses. And 3 of them got remarkably better with my treatment, and the 4th did not. So I trialed her on some ivermectin, but I was not aware of how high you can go with dosing. She did improve. She did
Increase the
improve.
dosing?
Mhm.
Yeah.
But it didn't stay, it didn't last. So now I would look back at her and say, aha, so here are the other antiparasitics that you need to use, and now we can go higher on the ivermectin doses, you know. But again, everybody's different, and you do have to look at the guidelines, of course, you know. But it's very interesting. But there's so much we don't know.
Do you happen to know what the normal dose is for that? Because pharmacists don't even know, like, they were warning me, like, I could have all kinds of problems with this, and I should be careful, and because they had no testing on it apparently.
Yeah. Well, the dosing varies,
Yeah.
you know, and it's all up to the doctor and his comfort level of prescribing. Because I don't think there's a normal dose.
Unless you're a horse.
Unless you're a horse.
That's why Walgreens, they assume pretty okay with it. Pharmacy, Walgreens pharmacy.
I went to Walmart, Walmart Pharmacy. They said, yeah, we got some here, we'll get some more. So I got it there, but I could not get it from Walgreens. So I went to community pharmacy, and my friend that is a pharmacist, his name is Richard, he got on the phone for a half hour to talk my insurance into giving it to me. Yeah, I was right there.
Well, that's the other
I
sad
watched
thing
it,
is
and
the
then
cost.
I was getting it, but somehow his cohorts decided not to do that anymore. But I think if I got back with him, he would probably get it for me again. And he has Lyme now.
I think you can get it like at Farm and Fleet, but
Yeah.
I mean, wherever you buy horse stuff, I mean, they give it to horses regularly.
Oh, I know, I tried that. But I couldn't relate to the same dosage, because the horse is like,
Yeah, I know.
I just couldn't relate. I mean, it started at a very high amount of weight, and then it comes in syringes. And so you inject yourself, but then I don't know what else is in there.
Well, I would just
In the injection.
caution people to be a little bit careful about that because, you know, we don't know what they're using for
I
fillers.
just think
And
we're
that's,
good.
and that is when you talk about mast cell, anytime you're using even any of the mast cell medications, if they're over the counter, you may very well be getting fillers that you might be reacting to as well, which might be another piece of the puzzle why you don't respond positively to some of them. Because who knows what they use as fillers? We all know that that's, you know. So that's why we love our compounding pharmacies, and you can get clean products, but you're going to be paying cash for them.
Exactly.
And even a med that you take one day, they can change it overnight, and you don't know that, and then you react to some dye or something that they've added that they didn't have before, so you're happily going on your way, and then all of a sudden, you're reacting.
And again, think mast cell when that happens, and not necessarily herxine, but think mast cell. Could this be, you know, is this what's going on? It's histamine. Histamine's gone crazy in my body, causing all this inflammation. That's part of the protocol, Dr. Penhouse protocol. It's using ivermectin, parental canoate,
What was that?
albendazole, Alinea. Parental is the over-the-counter Pinax,
Okay.
okay?
How long do you
and building side. Well, everybody's different, you know, but it requires up to 4 different rotations simultaneous, and they're all
What
used
are you talking about?
sequentially, not at the same time, except for the ivermectin and the parental. They're the only 2 that are used at the same time. So the others are 14, it's usually 14 days. The anti-parasitic treatment.
So Dr. Klinghart's protocol is, you can get all these, products over the counter.
No,
And
no.
some of it is pharmaceutical, you have to have a prescription.
They're all
Ivermectin
prescription
is
except
Oh,
for
prescription.
he uses,
And
And
then there
Olivia,
are 2
like-
herbs he suggests as well that are part of the protocol. Artemis
Some-
and Mimosa Paducah.
What was the second word you said, mimosa?
Mimosa Paducah, not just straight mimosa, you know.
That'd be nice.
It's like, yeah, that's,
Mimosa
at
Paducah.
least you could enjoy something.
It's just, it's so sad because, you know, all of these, pathogens in our body just take our immune system down and just make us so susceptible to so many things. And it's so complicated. I mean, there's just not any straight way to deal with any of this, which is why it's, I think, so frustrating for mainstream medicine, because, you know, an average visit does not give you enough time in mainstream medicine to know what's really going on. And I mean, we all know that. And even in my office, I mean, there are times where, you know, yeah, you need more time just to figure it all out. So, but there's, you know, at least we have people who are treating. At least there are people you can go to. At least there are websites, Alicia's website, to learn more about. You know, you have LymeDisease.org, you have iLads, you have different places to go to. And it's about, you talk and you tell your stories, and people hear you and they get help. I mean, that's pretty much how this works anymore. So at least you have all of that. And it's a moving tide. It's changing. More physicians are paying attention. They just don't want to go there.
They
just
don't.
No, they don't. And it's understandable because, you know, I mean, we're all at risk for doing this. If I were at the other end of my practice, would I be doing this? If I were at the other end of my career, would I be doing this? I don't know, you know?
So are we to be thankful because you're aging?
Right.
but iLads, they've been trained, this is part of their training now. I mean, it's pretty, would you say that mast cell activation is pretty much out there and well accepted, and they've been training people about this? No, this is pretty new?
Well,
We did have a presentation this last year at the ILADS meeting on mast cell, and that was the first time. And that was because we were all seeing it, and we knew we were seeing it, you know, and I think there was a lot of noise about it. So it now has come into our periphery as well, but it's just one more thing, you know. And I've asked a couple of docs about it, and they're like, no, that's for the experts. And like, but the expert has an 18-month waiting list. You know, that's how it always happens.
But bringing this up, doesn't it kind of just make you cough when you read the IDSA and the CDC's guideline of 21 days of doxy? I mean, it really does make that a joke, because we're dealing with a complex of so many issues. You could go down bunny holes ad nauseum and never, you know, reach a conclusion.
Well, it's very frustrating, and everybody who's been ill understands that. You know, how many different doctors do you have to go to before you get an answer? How many specialists, how many clinics, you know, how many healthcare systems? And I mean, it doesn't have to be that complicated, but it's going to require a different kind of system, really, for effective treatment, because you can't fix it in 10 minutes. You just can't. You can't begin to hear that story in 10 minutes, you know, even an hour and a half. It's a tough thing to do. So it's just one table where they're actually have, somebody had a tick repellent. And I thought, God, I suppose I should come down here and have a booth myself next year, you know?
Yes,
I thought, oh yeah,
yes.
ruin everybody's fun, right? We're all about the outdoors, ruin everybody's fun. But I probably should, doggone it. You know, it just doesn't go away, and that's the problem. The ticks, we've had studies where the ticks are active in temps as low as 17 degrees, 24 degrees. The only way to really kill them is by fire. Seriously. I have a friend, or else they'll die after they lay eggs. I have a friend, pulled a tick off of him in March. He put it in a jar, kind of forgot about it. 3 weeks later, it laid eggs. It was like this little fuzzy cotton ball stuff. I'm not kidding you, this is real.
No,
And he had to pull out the magnifying glass, you know, to see what was going on in there. That was March. September, it wasn't until September when the tick stopped moving. March to September, the eggs, the larvae dried up. There was no air, no water, no food for that long. The bacteria are smart. They found the perfect host. And that's what bacteria do, and that's what parasites do. Think about it, they survive. I mean, how brilliant. Oh my gosh. You can't drown a tick, don't flush them in the toilet. You're gonna come out somewhere. All right, okay, any other questions?
What do you know about Martans?
Oh,
Not too much, or do you a lot?
yeah, you know, I've listened to Neil Nathan a number of times.
Yes.
And certainly mold is just one more component of a compromised immune system. Not for everybody, but it's definitely a player in there. It's something that needs to be paid attention to. There's all kinds of stressors. You know, what was your childhood like? Let's talk about exposures in your life. Let's talk about, you know, trauma, period, whether it be physical, psychological, emotional, you know, what diseases have you had? What viruses have you had? Where have you traveled? What, you know, it's not any one thing. Our body's very complicated. So yeah. All right, well, thank you all very much for coming. And if you have any other questions, I'll stick around for a couple minutes. Otherwise, go out and enjoy this cold, sunny day.